the United States of America, and Vietnam. The team also included experts from WHO, the Food and Agriculture Organization of the United Nations, and the World Organization for Animal Health. I want to start by thanking all members of the international team for their work. This has been a very important scientific exercise in very difficult circumstances. The expert team is working on a summary report, which we hope will be published next week, and the full final report will be published in the coming weeks. We look forward to receiving both reports, which will be released publicly. When the summary report is published, we will hold a further press conference with the full international team. Some questions have been raised as to whether some hypotheses have been discarded. Having spoken with some members of the team, I wish to confirm that all hypotheses remain open and require further analysis and studies. Some of that work may lie outside the remit and scope of this mission. We have also said that this mission would not find all the answers, but it has added important information that takes us closer to understanding the origins of the virus. The mission achieved a better understanding of the early days of the pandemic and identified areas for further analysis and research. And we will continue working to get the information we need to answer the questions that still need to be answered. Today, we're joined by two members of the international mission, Dr. Peter Ben-Mbarek, the team lead of the international mission, and Professor Marion Koopmans, head of the Department of Viroscience at the University of Rotterdam, the Netherlands. Dr. Ben-Mbarek and Professor Koopmans will be available to answer your questions. Meanwhile, the number of reported cases of COVID-19 globally has declined for the fourth week in a row. And the number of deaths also fell for the second consecutive week. These declines appear to be due to countries implementing public health measures more stringently. We should all be encouraged, but complacency is as dangerous as the virus itself. Now is not the time for any country to relax measures or for any individual to let down their guard. Every life that's lost now is all the more tragic as vaccines are beginning to be rolled out. Alongside traditional public health measures, how quickly we can collectively expand vaccine manufacturing and roll out vaccines to all countries will determine how soon we can control this pandemic. At the beginning of the year, I issued a global challenge to ensure that vaccination of health workers and older people is underway in all countries within the first 100 days of 2021. Next Friday marks day 50. Today, I'm inviting everyone to join me in a call to action to accelerate production and share technology so we can produce enough vaccines for the world and share them equitably. Some people didn't think it was possible to produce a vaccine so quickly, but it was, and very historic. Never in the history of the world had we actually developed vaccines in less than a year after the emergence of a new virus. Now, some people say that vaccinating the world is not possible. They are dead wrong. As Nelson Mandela Madiba said, It always seems impossible until it's done. So join me. Wherever you live or work, sign onto the new declaration and let's build a movement to make history together. It's everybody's responsibility. Vaccines are vital, not only for saving lives, but also for preventing the long-term effects of COVID-19, which we're only beginning to understand. WHO's work in this area focuses on 3 key needs for these patients: recognition, research, and rehabilitation. Earlier this week, WHO held a global meeting of patients, clinicians, and other stakeholders to advance our understanding of what is officially called post-COVID condition or long COVID, discussed with very distinguished colleagues and people. This was the first in a series of meetings and focused on working towards an agreed clinical description of the condition, which will be important for clinicians to diagnose and treat it. This illness affects patients with both severe and mild COVID-19. Part of the challenge is that patients with long COVID can have a range of different symptoms that can be persistent or can come and go. Earlier this week, WHO released a case reporting from that will allow more data to be collected on long COVID in a standardized way. This will help to improve the understanding, surveillance, and clinical management of the condition. Given the scale of the pandemic, we expect many people to be affected by post-COVID-19 condition or by long COVID. And of course, the best way to prevent long COVID is to prevent COVID-19 in the first place. Finally, yesterday was the International Day of Women and Girls in Science. And I would like to pay tribute to all of the incredible women scientists who work for and with WHO all over the world, including those at this press conference: Janet, Kate, Maria, Maria Angela, Soumya, and Marion. And also all colleagues, Gabi, Fidela, Aurora, and others. I want to say to all of you that you are an inspiration to me. And I hope you are an inspiration to many girls and boys around the world. And finally, I would like to wish everyone who observes it a very happy Lunar New Year. Fadila, back to you.
Thank you, Dr. Tedros. I will now open the floor to questions from members of the media. I remind you that you will need to raise your hand under the raise your hand icon in order to be able to ask your question. I will start by giving the floor to AFP, to Robin Millard, Agence France Presse, to ask the first question. Robin, can you hear me?
Yes, hello. Thank you, Fadela. A question for Peter Ben Embarek. Now that you've returned from visiting Wuhan, do you think that if you'd been allowed to go much earlier, you would have found more evidence and more conclusive evidence? Thank you.
Thank you for the question. It would have been difficult to go there much earlier. If you remember last year in February, it would have been impossible to be in Wuhan because Wuhan was in total lockdown and in the middle of fighting the disease. And that took a few months before the city was reopened and business returned to normal. During the summer, we then were in China and developed plans for working in Wuhan later on. And we then engaged with the international community to identify an international team of experts, identify a Chinese team of experts, and then planned the current visit we just achieved. So it took a few months. And the work we were able to analyze and looked at this time took months to conduct. Many of these studies have involved thousands of people and researchers in China to conduct. And if we had gone much, much earlier, we wouldn't have had the same material to look at. It was not a mission to go and chase an animal in the market or chase a patient somewhere or looking for that type of evidence. So it was a totally different mission than what you somehow imply could have been done. In that case, it would have been, if we had done that kind of investigation on the ground, chasing the first animals and the first patient, that would have been something that could have been done perhaps back in December when the outbreak is and was detected. But often when these emerging disease outbreaks happen, the first reaction, and that's a natural reaction, is to treat patients, to understand the disease, to find cases. It's not about to try to figure out how this happened. But maybe that's something we should look at in the future on how better respond to emerging disease outbreaks. Thank you.
Thank you, Dr. Peter Benimbark. I would like now to invite Paulina Alcazar from Encadena News, Cancun, Mexico, to ask the next question. Paulina, you have the floor. Paulina Alcazar.
Hola, ¿me escuchan?
Yes, go ahead, please.
Gracias, Fadela. Buenos días a todos. Nuestra pregunta, en un lugar turístico como es Cancún, sabemos que se ha pedido a las personas...
Paulina Alcazar.
Hola, ¿me escuchan?
Yes, go ahead, please.
Gracias, Fadela. Buenos días a todos. Nuestra pregunta, en un lugar turístico como es Cancún, sabemos que se ha pedido a las personas vacunadas que vienen de todo el mundo que continúen con el protocolo de usar cubrebocas, distanciamiento físico, lavado de manos, etcétera. Pues con la vacuna no se enfermarán, pero no están exentos de infectarse e infectar a otros. ¿Cuál es la diferencia de las personas que pasaron por la enfermedad y generaron anticuerpos? ¿Significa lo mismo? ¿Que posiblemente se vuelvan a contagiar, no se enfermen y sigan infectando a los demás? Gracias.
Dr. Swaminathan will start. Thank you.
Yes, thank you for that question. It is an important question, and I should say that our understanding of this is evolving as more and more studies are coming out. You asked about people who've been infected with SARS-CoV-2, have had the disease, and if they are susceptible to get the infection again and transmit again, and also about people who've had vaccines. And both of these are areas of active research. We know that after you have an infection, a natural infection, that you do develop immunity. And studies have shown that these antibodies that develop last for at least 6 months after the infection. And that apart from antibodies, you also develop something called cell-mediated immunity. So the immune system has two arms, a cell-mediated response and an antibody or a humoral response. And the antibodies are, of course, easier to measure, but the cell-mediated immunity also plays an important role. And in fact, those are the memory T cells that last for much longer. And we know from SARS-1, for example, that this can last for many, many years. So ongoing studies will tell us how long people are protected. And there was a recent study done in the UK which showed that having a natural infection, if you look at these cohort of health workers who were followed up, for 6 to 8 months, that there was at least an 85% protection against a repeat infection. Again, we're now getting reports of people getting reinfected with a new variant of the virus. And there have been some initial reports from South Africa suggesting that people who've had prior infection could get infected again. It's a similar story with vaccines, really. We're learning about protection against vaccines. And one thing that's clear is that the majority of clinical trials that have reported out so far, there's a clear protection against severe disease which needs hospitalization and death. So I believe that in all the clinical trials that have been done so far with the 7 or 8 candidates that we know about, there's been no case of a death or a severe disease with hospitalization occurring in the vaccine group, regardless of which vaccines. I think that is clear. It is protecting against severe disease. Whether it's going to protect completely against infection is not so clear, and it might reduce the severity of infection. There are reports now that if you have the vaccine and you get infected, the viral load is much lower, so the chances of infecting others may be lower. But till we know more about this, it is important for people, even after vaccination, to take precautions, to wear a mask, to wash hands, to maintain the physical distancing, to really reduce the risk of, even if you have an asymptomatic infection, you're not going to get sick because you've had the vaccine, but you could still carry the virus in the nose and spread it to others. And so we need to make sure that we are controlling the spread of infection by taking all precautions. And Maria or Mike, you might want to add to that.
Thanks, Sumya. Just to reinforce that last part is that it's really critical that we continue to carry out the individual level actions, whether we have been infected through natural infection or we have been vaccinated. And as we learn more about this immune response, as Sumya has outlined, we need to continue to adhere to the measures. We need to continue to physical distance, we need to continue to mask, we need to continue to wash our hands, avoid crowded spaces, opening the windows, because this will prevent onward infection. And so we are learning every day, as Sumya also has said, we're learning more and more every day about natural infection, but also about the impacts of vaccination, and it's really critical that we stay the course. These measures work. We are seeing these measures work in countries that have these virus variants, that have all of the different SARS-CoV-2 viruses that are circulating globally. These will break chains of transmission. They keep you and they keep your loved ones safe. So it's a really important message to reinforce that we have to stay the course and do everything we can. So follow all of the local guidance, continue to distance, mask, hand washing, open windows, avoid crowded spaces, etc., because this will keep you and your loved ones safe.
Thank you. I would like now to invite Helen Branswell from STAT to ask the next question. Helen, can you hear me?
Yes, thank you. This is from Mike. I'm hoping you could give us an update on the Ebola outbreak the Ebola cases in North Kivu. Has INRB managed to sequence the data yet and indicate whether this is linked to the previous outbreak or is a new outbreak? And do you have any information on whether any of the people who've been infected were vaccinated in the earlier outbreak? Thank you.
Dr. Ryan will take this question.
Thanks, Alan. It's great that I can understand Canadian. The connection wasn't 100% good, but I think I got it. With regard to the sequencing, and with great credit to our colleagues in Congo, the INRB received the samples in the last 2 days. The sequencing process has already begun, and we expect Prof. Miembe and his team, Steve Ahuka and others at INRB to report the genetic sequencing results over the weekend. They're very important, and that's from the first case. We've had that second case, again another female case, a lady of 60 who died. and we've had a further case reported this afternoon, though I don't have details of that case. There are epidemiologic links between the two unfortunate women who've passed away, but we're still unclear around the original community source of the case. 182 contacts have been listed, 95 in Vienna and 87 in Katwa. And only 3 of them remain unseen at this point and unfollowed up. What is heartening is that over half of those contacts were vaccinated in the previous Ebola outbreak, and most of those are actually health workers who were previously vaccinated. So we're seeing some benefit to the previous vaccination, but obviously we have to look at the length of time that the vaccine protects. The alert system has begun already. We've already had 17 high-risk alerts from the community, 7 alive, 6 community deaths. All have been investigated, all have been tested, and all are negative. We've seen the Butembo laboratory for Ebola virus disease has been reinforced, and we have 9,000 gene expert cartridges in country, trained technicians on site. First shipment of Ebola vaccines was transferred to Goma the day before yesterday, arrived in Butembo today. The cold chain equipment, ultra cold chain, has been set up in Butembo today. Vaccination teams are being trained today, and we have over vaccine in country to vaccinate 16,000 people, and we have MAB 114 and Regeneron monoclonal antibodies in country to treat 400 patients. Those therapeutics are currently in Kinshasa and Bandaka, and they're being airlifted into the area over the weekend. We've already begun with colleagues in NGOs and with UNICEF and obviously with the government and Red Cross to work on infection prevention, control in the hospitals, safe and dignified burials with the Red Cross movement, risk communication and community engagement with UNICEF and partners, and continue to run the EVD survivor care program in the area. Logistics is difficult, but we do have ultra cold chain technicians on the ground, and more of that equipment arriving, as I said. We have both international and national staff on the logistics side, fleet managers, a small number of vehicles, and a lot of other equipment to refurbish the Katwa Treatment Centre, which is currently being upgraded for treatment of cases. We've also transferred a specialist VSAT, satellite communications equipment, from Mbandaka into the area, and Thuraya satellites, equipment, generators, and other material that will help support the response. So we're doing this in support of the government and their leadership in the response, and in partnership with our colleagues in UNICEF, Red Cross, international and national NGOs in the area. Obviously, 2 cases and now a third may not seem like many cases in the light of what we see globally with COVID, but we've been on the alert waiting for any signal of the return of Ebola in Eastern Congo, and we'll do everything in our power to support the government and the response. I think that's it, Helen. We will obviously let you all know when we have sequencing results, and you're right to ask that question. It's really important that we understand the origin of this first case, and that sequencing data will give us vital information to move forward. Thank you.
Thank you, Dr. Ryan. I would like now to invite Megan Moltini from Wired to ask the next question. Megan, can you hear me?
I can, yes. Can you hear me?
Yes, go ahead, please.
Yes, thank you for taking my question. I'm hoping you can respond to some of the criticism around the kind of limited new information that has come out of the joint mission into the origins of SARS-CoV-2. Given the amount of time that's passed and the limited access to raw data that team got, does WHO consider the joint mission a success at this point?
Thank you, Megan. Dr. Ryan will take this question.
Yeah, in my experience in public health, success is a relative term and can never be declared. I think what we've made is progress, and certainly recognising the leadership that Peter and the team have shown. We've made progress, And that's all you ever make in science, is progress. And I would say that we all are always very anxious to get in and understand the origins of disease. In my own experience, it took us years and years to even begin to understand the origin of Ebola. And we would respond to outbreak after outbreak before we even begun. And even now we have great unknowns as today. How did this virus start this new outbreak? Is this from a survivor? Is this from another source in the animal kingdom? Was this something frozen months ago and has thawed out? We don't know what might have started that outbreak. We have clues. And sometimes those clues are obvious and sometimes they're not. And sometimes the initial chains of infection in any epidemic can be very long. And the point at which you see the flames is never usually the point at where the fire started. But as Peter said, your first job is to put the flames out, get the epidemic under control, and then when you can, you go back and you look at the trail and you try and unravel the usually complex history, and in this case with the animal-human interface, even more complex history around the emergence of a disease. So I would characterize that we've made progress, but I would leave it to Peter to characterize his own view. But success is not something you can ever declare really in public health.
Yes, no, I think we have, I'll be a little bit more optimistic than Mike here. I think we have been successful in many ways. We have made a lot of new knowledge about the start of the event. We have a much better understanding of what happened in December 2019. We have been able to demonstrate that there was substantial circulation of the virus in Wuhan in December 19. We've been able to link genetic sequences of different patients across the city in December with their physical location in and outside the market across the time from early December to end of December. So we have a much better understanding of what happened there in December, much better understanding of what happened in the market, the role of the market. We have also been able to trace back all the suppliers of different wild animal products into the market as a potential clue for further studies. We have also much better feeling and understanding that there was no widespread and no large cluster of the disease in Wuhan or in elsewhere around Wuhan in the months prior to December 19. So we have much better understanding of what happened. We still are far away from understanding the origin and identifying animal species and all the pathways from which the virus could have entered the human in December. But as Mike said, this is only the first step, and we knew from before going there that it would take a long time and a lot of efforts to get there. So it's just the start, but we have made a lot of progress. I don't know if Marian, who's online, would like to add to that.
Yes, if
you have the floor, Dr. Koopmans, please go ahead.
Yeah, there was an echo. If I just a small addition, I think what is important to realize is that understanding what was not the case is also part of understanding where to look further, and that's never the most enthusiastically shared part of science, but critical part of it. So one of the elements that was done and reviewed is, for instance, the testing and screening of more than 30,000 animals of different species from different locations to get a first broad brush idea if there's any of those potential reservoir. All of those tested negative. Now that could just as well have yielded a smoking gun, which is what happened when the same was done during the MERS outbreak. Now, in this case, it tells us that there's not a clear candidate for an intermediate host yet.
But the work on the market and the traceback process that was done there does provide some leads for next steps in the studies. And I think those are as important parts of a quest like this as data that tell you the positive news.
Thank you, Dr. Van Kerkhoff.
Very, very briefly, just to support, what is being said, is that the report hasn't actually been issued yet. So the report is in progress, as the Director General said, and as the team said previously, there will be a summary report, and then there will be a full report. So there is more information to come, but as you have been hearing from the start, no one mission can answer every question. It's always a series of studies that are always done. It's a collaboration. It's a process. And as Marian and Peter have just said, finding this information and then asking more is always part of that process. So we need to manage the expectations of what is coming from one mission report, but then know that there's a series of studies and that will continue. This is how this works in terms of our understanding, and we're advancing our understanding, but the report hasn't been issued yet. So saying there's limited information, we really need to issue that, and the team is working very hard to make sure that the summary is issued as quickly as possible, as well as followed by a full report. And as you heard, the Director General said that there will be a further press briefing by the whole international team when that summary report is issued. So there is more to come.
Thank you. I would like now to invite Simon McCarthy from South China Morning Post to ask the next question. Simon, can you hear me? She's not.
Thank you so much for the opportunity to ask the question. Can you hear me?
Very well, Simon, and thank you for being with us so early in the morning.
My pleasure. Thank you for, I'm grateful for the opportunity to ask a couple of questions to Dr. Van den Barek and Dr. Koopmans. One of the things that and I'm very much looking forward to the report, as Dr. Van Kerkhoff said. One of the things that I wanted to ask about is, we noted no evidence of widespread circulation prior to December 2019. Could you please tell us if you believe there is evidence suggesting that there may have been any earlier cases? For example, I, of course, saw the Wall Street Journal report regarding the 92 cases with COVID-like symptoms in Hubei hospitals. I'm just curious to know a little bit more about the circumstances of those cases and what further testing strategy you would recommend within China to continue to understand any cases prior to December 2019. Thank you.
Thank you, Simon. I would like to invite Professor Marion Koopmans to take this question. Professor, you have the floor.
Yes, thank you. So the first conclusion was reached after reviewing 3 big pieces of work that have been done and that will be described. One is a detailed overview of mortality statistics and looking and analyzing them to see if something unusual had happened in the period before December. The second was doing that for influenza-like illness, and the third for a national disease reporting system that reports all kinds of disease. Now, for this third system, that involved 97,000 individuals or records that then were reviewed by teams of clinicians in the different healthcare settings that had those records, and they down selected that with their views on or their knowledge on the clinical presentations to 92 cases. So. And those 92 cases were then looked for and were tested recently for antibodies. Not all of them were available anymore. Some of them had died or some of them could not be reached. So that's what's been done. Now, that the difficulty there, so that is potential COVID cases, but based on the available evidence are tested negative, so would be ruled out. The one question that is out there is, can you still rule that out a year after an infection, for instance? Is the serology negative then? But this is the basis of what was done. Now, in order to take that next step and then maybe look for small pockets of cases, is to do a more extensive serological study, but with historic samples. And they have now been identified through a blood bank system. And there is a discussion ongoing in China to be able to access those, because that would give a better view of the situation on the ground in November.
And that there is a World Health Organization briefing the media on its global study of the origins of the coronavirus. Some very interesting information coming out there, as you've just heard. They have been looking at the first 92 original cases, and those have been subjected to antibody studies to better understand, of course, how the disease has behaved in the past couple of months. They were saying that, for instance, that just this particular mission, they would like to clear up reports saying that they are not forthcoming with information, that it's really unfair, really, to have such high expectation of the first of a series of studies that is going to look at the origins of the coronavirus in Wuhan, but saying that from what they've gleaned so far, there is certainly evidence that the first couple of cases of COVID-19 have been traced back to the market there. Also speaking about the Ebola outbreak in the Democratic Republic of Congo, you'd know that this is one of the greatest challenges that the country is facing, but especially the WHO, as this is now the 12th outbreak, I think, of the Ebola virus. The report back that is 2 people have died so far, one a 60-year-old woman, and there's contact tracing happening of over 100 people, and that there are vaccination teams that are being trained and are being deployed to the area. Well, that's